Welcome to the Art of Engaging Residents and Families conference call. My name is Adrienne, and I'll be your operator for today's call. At this time, all participants are in a listen-only mode. Later, we'll conduct a question-and-answer session. During the question-and-answer session, if you have a question, please press star, then 1 on your touch-tone phone. I'll now turn the call over to Christy Worgen.
Hello, everyone. This is Christy Worgen with Lake Superior Quality Innovation Network, or Lake Superior QIN. Lake Superior QIN represents Minnesota, Michigan, and Wisconsin under the Centers for Medicare and Medicaid Services Quality Improvement Organization program. I would like to welcome you to this educational session entitled The Art of Engaging Residents and Families. All lines will be muted during this webinar. However, after the presentation, we will have a time for questions and answers, so please make a note of any questions that may come up as you listen, or place your question in chat. We're pleased to have Lisa Juliar as our speaker for this afternoon. Lisa currently works as the Engagement Specialist and Patient Partner for the Minnesota Alliance for Patient Safety, or MAPS. Previously, she partnered with the Minnesota Hospital Association for 4 years as the Patient and Family Engagement Consultant and the co-chair of their first Patient and Family Advisory Council. In partnership with the Minnesota Hospital Association and the Partnership for Patients, the Include Always model was developed, and Lisa was able to inspire and educate hospitals and healthcare systems to partner with patients to increase patient quality and safety. Lisa, I will now turn it over to you.
Thank you, Christy. I'm really excited to have the opportunity to speak to an audience of professionals who are dedicated to making nursing homes the best place they can be for our elderly friends. I want to just tell you transparently that my credentials come from my experiences, and my passion is to bring the voice and stories of the residents, patients, and families to the forefront of discussions around quality and safety improvement. Before I had children, I worked as a nursing assistant in nursing homes and hospice for 4 years, and as an occupational therapy assistant in nursing homes for 4 more years. So I actually have a really special place in my heart for this population. In the past 16 years, I've traveled a journey through the healthcare system that has been full of too many difficult and frankly traumatic experiences. These are not the stories that I will share with you today, but on the positive side, because of these stories of a misdiagnosis, adverse event, my daughter surviving sepsis, and others, I have been invited into the system, I've been listened to, and the many healthcare organizations that have partnered with me have allowed me to great opportunities to engage and collaborate on changes that can make healthcare better and safer for everyone. So today, the objectives that I'd like to address are really understanding the benefits of including residents and families in your quality and safety work. I'm going to give you an introduction of the Include Always approach to increasing your engagement. Hopefully you will understand a different role that you could play in including residents and families as partners. And I always like to inspire you to think about this differently when you start to engage your residents and families in new ways. So in my experience, we can all learn more effectively when we are transparent with our struggles, we share our success, and we actively participate in the process. Your voice is important to me, and I'd love to hear from you throughout this webinar. Please use the chat box to share your experiences, ideas, and questions related to the things that we're talking about. In the beginning, I just want to know, are there ways that your organization currently partners with residents and families on ways to improve safety and quality? And if you can just put some of those answers in the chat box, that would be really helpful moving forward, just so I understand kind of where we're starting from and what the foundation is. And if you don't have anything, hopefully by the end you'll get some ideas on how to do that in a different way. So a bit of background on the Minnesota Alliance for Patient Safety. It was originally created in 2000 with the idea that they would not compete on safety and that everybody needed to work together to make it safer in Minnesota. The focus of the work was and still is to improve care across the continuum of settings with an understanding that including residents, patients, and families is critical to the goal of achieving safety. In 2012, it was incorporated, and just recently in August of 2017, they aligned with Stratus Health to make a stronger partnership.
And I just want to share, there's a couple things here that we have in chat, and it looks like resident councils, that seems to be a big place here. Resident input in meals, quality of food, activities, addressing concerns of residents. Someone has a weekly safety meeting for residents where they're able to voice any safety concerns. The resident council seems to be the...
Great, thank you so much. That really helps me understand the things that are happening out there. Again, resident and family councils. And on the current performance improvement team. Awesome. You guys are doing lots of good work out there. Okay, so the next slide is the slide that I least like to share, but it drives the work that absolutely continues to need to be done. In 2000, the Institute of Medicine released a report called To Err is Human to increase awareness of the enormous safety problems in healthcare and to build a better system by understanding how errors happen and what we could do to make them better. It emphasized really that errors are not typically due to an individual's competence, good intentions, or hard work. We all know that people go into healthcare because they want to take good care of people. But instead, they emphasize that it's an issue of how systems are designed and implemented. And I'm not going to go over those statistics. You can read them, but I think they're pretty significant. So unfortunately, in 2015, there were two separate reports released that outlined how, although some progress has been made since the To Err is Human report, not nearly enough has been accomplished, and our safety is far from what it can and actually should be, requiring a more pervasive response. Each report included recommendations, but today I'm really going to focus on the recommendation to partner with patients and families. And as you can see there, this is the Institute of Medicine and the Improving Diagnosis report. On the next slide is another report called Free from Harm from the National Patient Safety Foundation. And what was unique about this report is that it called out that not only is preventable harm occurring in the hospital setting, but equally across the board, including long-term care, clinics, and homes. So again, it's really important that patients and residents and families are included because it happens even in their homes. And if you think about it, the perspective that patients and residents and family have is that healthcare is healthcare. It doesn't matter where it's happening or how it's happening, it's happening to them. And so they are the one consistent thing that happens across the board. And we need to make sure that we're respectful of their experiences, opinions, and feedback. So I think that the foundation is, we need to really understand what are we talking about when we talk about resident and family engagement. I took this and adapted it a little bit from AHRQ in that residents and families are treated as individuals and as members, I would like to say equal members of the healthcare team. That staff actively listen to the residents and families about what they want and need, and it sounds like you all probably do that during your resident council meetings especially. That resident families and staff work together as partners, and that staff ask residents for their ideas and act on them. And I'm going to talk about that a little bit more about what acting on them means at the end of the webinar. So why do we want to do this? What are the benefits of resident and family engagement? And we know that the more engaged they are, the better care they receive, better quality of life, greater resident and family satisfaction clearly. But what has been surprising to me as I've worked in this is that actually the staff are much more satisfied and express a lot more joy in their work when they start really authentically partnering with their residents and families. There's more attention paid to the preferences and needs, and improved relationship and trust among staff, residents, and families, and I would say even among each other, staff to staff, has been improved by engaging the residents and families. And what are the benefits for residents and families? I'm not going to go through all of these, but I would say that this is really critical. I show a video sometimes of residents expressing why they want to be included, and it's really powerful because they want to have purpose in their life still, and I think that that's one of the biggest gains that you get. But this is also their home. They want to be part of the organization and many more things, and I'm not going to go through each bullet point. But also, there's benefits for the nursing home. You get to learn what the priorities are for your residents, which might not always be what you select or what you think is important. Many times it is different, actually. You get to hear directly from your residents, and you get to develop programs and policies that are relevant to what they need and want. It also strengthens community relations in that when they leave the nursing home, when their families are in and out of the nursing home, they start talking about how you are engaging them and what changes you are making compared to what they're asking for and what they're telling you. So on paper, it seems like patient or resident and family engagement would be pretty easy to do. But in reality, it can be an extremely challenging undertaking on top of everything that you all have to do. One of the things that I learned when I started into this work, into becoming part of the system, is that there are an enormous amount of regulations, policies, checklists, to-do lists that you have to take care of. And so when you are asked to do another thing, like resident engagement, it can feel like just another thing to do. And also, I think that people who are caregivers have been expertly trained to do things to and for the people that are under their care. Resident and family engagement actually asks you to do something a little different in that it asks you to do things with your residents and family. Doesn't seem like a big difference, but it can be. It can be a lot more difficult to do things with them and partner with them instead of just kind of taking control and doing it for them. So generally, people are better and find it easier to engage residents and families at the point of care. A lot of that is about the resident-centered, person-centered care type of strategy, but generally people are unsure about how to incorporate resident engagement at an organizational level. I'd like to suggest that stories are a perfect place to start. And I'm not talking about a staff member sharing a story with another staff member about what happened to a resident. I'm talking about inviting and supporting residents to come to these types of events listed and share what it was like for them in certain situations. I also think it's impactful to share your stories among yourselves and what happened to you and how it affected you in your workplace. But because I believe so strongly in the power of stories to inspire change, I'm going to share one of my more recent experiences with you today. I actually spend a lot of my time coaching people to tell their stories. I start with one really important point in that it doesn't matter where the story happens or who the people are related to the story. It's pretty irrelevant because it could happen at any organization with any person when you hear a story. But I also tell them that they need to focus on explaining what the experience was like for them, what emotions maybe were attached to the experience. If there's any humor in it, which many times they start out by saying, oh no, this was not funny, this was sad or I was angry. But when I push them a little farther, there's always something that can be found that's funny in that story. So I ask them to share that when they're giving their stories to other people, and also to have an element of empathy for the other side of what's happening to them. So recently I was invited to speak at a hospital, and they offered me from the beginning a hotel room in their nursing home. And I had never heard of that concept, so I was pretty excited about it. And I actually called my kids and told them that I'd be staying in a nursing home, and they were a little concerned, but I was excited. So I needed to travel to actually 2 separate hospitals that day, and I'd been on the road for 8 hours in between. And at the end of the night, I had done all my presentations, and the staff at the hospital asked me if she wanted me to accompany me to the nursing home to check in. It was late and dark and cold, and I knew her family was waiting for her, so I told her that I could handle it. So I got in the car and drove over to the nursing home. On a side note, it was unusual, but I had no phone service, which was not typical. I usually had phone service no matter what town I went to, but this particular time I had no phone service. So I arrived at the nursing home in my suit and my heels. I had my overnight bag, a briefcase, a purse, and I pretty much looked like a pack mule. I stood at the desk as a staff member was sitting there, and she was enjoying a grilled cheese sandwich, which she did not seem to want to break from to address me at the desk. Finally, after standing there for a minute, I said, "You know what, I'm really sorry to bother you, but I am here to stay in your hotel room." She looked up at me with butter dripping down her chin, kind of like I had 2 heads, and she said, "Honey, this ain't no hotel. This is a nursing home, if you can't tell." I nervously chuckled and I said, I realized that I was presenting at the hospital, and they told me that I could stay at your room, in your room that you have for guests. She actually took another bite of her sandwich and then said, "I guess I'll ask the nurse what I should do." I stood there what seemed like about 10 minutes when she came back, seemed upset, and said, "All right, follow me." I watched her push people in wheelchairs out of the way. She didn't warn them that she was going to push them away. She didn't speak with them, and some of them wound up facing right into the wall. We walked down a long hallway. I was trying to keep up with her while holding all my bags, and she brought me to the end room and said, "This should do. It will most likely be the quietest place for you." I walked in, and I looked around and saw 2 full white plastic garbage bags, and I asked her if she knew what they might be. She patted them and said, "Nope," but she left them there anyhow. She then asked if I wanted her to lower the bed down for me. It was up above my head, and I didn't know how to work the bed, and I said, "Sure, that would be great." And she said, "Well, you should have everything you need. If you want some water, you'll have to come to the desk." And she walked out. Now, I could say that I wasn't sure that this was the hotel room I was imagining. There was no lock on the door, and I actually felt a bit unsafe. So I looked around, and I actually found a sign that said "Family Meeting in Progress," and I thought, perfect. I put it out on the door and thought, okay, that will help me for the night. I walked into the bathroom, and there was no shower, but there actually was an old list of what one of the residents' preferences were hanging on a clipboard. I don't normally do this, but I kept talking to myself saying, okay, I can do this for one night. And the room did have a fridge and a TV, so maybe someone considered it to be like a hotel room. Luckily, I brought a pair of clothes. I brought layers of clothes, so I changed into a pair of sweats with a flannel shirt. I was freezing. I decided just to go to sleep so I could get through the night. When I went to pull down the comforter, there was a big blue chuck. Yikes. This was going to be a challenge. I removed it and I climbed into the bed, although it felt a little bit more like the picture you're seeing on your screen. It was cold, it was hard, and every time I moved a muscle, it made a noise. I could hear people in the hallway. I wondered if anyone was going to wander in. I laid most of the night awake and wondered when the nearest coffee shop might open in a small town. I just wanted to get out of there. When the sun came up, I hurriedly made my way out, stopping briefly at the desk to tell them I was leaving and so they might want to change the bed. The nurse kind of chuckled and said, "So, how was it for you?" The only thing I could say is, it was definitely an experience. I went and had my coffee and then proceeded to the hospital and approached the hospital staff for my next presentation. She said, "Oh, how was your night? Isn't it fabulous there?" I was so confused as she talked about the fireplace and the comfy double bed. It wasn't until I returned home that I realized I just might have been in the wrong place. Nobody questioned my stay, so I wasn't sure about that, and nobody had even asked me my name when I checked in at the desk. I was actually embarrassed that I had made such an error. I didn't even want to call the person to ask further about what had happened and why it had happened. But after a few weeks, I realized that actually this was a great opportunity to share my experience in some way with others. So the 12-Wandi says that outsiders tend to be the first to recognize the inadequacies of our social institutions. But precisely because they are outsiders, they are usually in a poor position to fix them. And I could tell you that that night, I felt very much like an outsider, and I felt very helpless to do anything to help myself, much less help the system. So from my perspective and what I learned just from that one experience is that I really wanted someone to hear my story. I wanted to be able to get it out and just share what it was like to be within the walls of that nursing home, although I never anticipated being in that situation. As I told the story each time, it got a little easier to express what it was like for me, what those feelings were, and actually it was like being a secret shopper. It wasn't intentional, but it was very much something where you could learn from it. I actually wanted to make sure that other visitors and residents had a more positive experience. And as I said before, knowing how much people have to do in a nursing home, in a hospital, anywhere that you receive care, the staff at the desk, she seemed tired and overwhelmed. And that was really clear to me, and I had a lot of empathy for her. I was actually kind of frustrated with her because my needs weren't being met. But I had a lot of empathy for what she may have been experiencing and what her caseload was and why she was acting the way that she was. I felt powerless, honestly. I didn't have a phone to check in with anybody. I didn't have another option. There were no hotels that I knew of. I couldn't even check on my phone or my computer because I didn't know anything about the internet there, and I just wanted to kind of keep it to myself. I didn't understand the system, so I didn't understand that there even was a different place for me to stay, quite honestly, but I didn't understand who was talking to who and how they even knew who I was. But I also didn't know who to go to with any questions or concerns at the moment. And after telling the story and being heard, I felt more empathetic and empowered to do something different. So the embarrassment that I felt for doing the wrong thing, for being in the wrong place, actually changed to feeling more empathetic on what it's like to be in a nursing home, wanting to do something to share that, and being empowered to do anything I could to share that experience so that people understood what it was like to stay in a nursing home. Not intentionally, but I actually could really feel what it might have been like for my grandma or somebody else that might be experiencing that. So I had a new perspective when I stayed a night in the nursing home, and on this webinar I'd like you to just consider maybe a new way of looking at doing business, of not doing things to and for your residents and families, but doing them with. When I worked in the hospitals, I actually did a lot of work with patient and family advisory councils, but they were connected to, it was hospitals, clinics, and nursing homes. So it was a great group of people that gathered together. And the reason that we did that is because the Minnesota Hospital Association had created a approach called Include Always. And it was because people were struggling to do patient and family engagement within the hospitals, and it felt like another thing to do. So Include Always was created to help alleviate that, to gather the best tools and resources to share with the people, and to actually share successes with each other. There was a lot of networking happening, a lot of patient and family advisory councils being created, and those councils would share with each other what was successful, what was hard, and how they could even work together throughout the state. So the mission of Include Always is on the next slide, and I'm going to read it because I think it's really impactful. Include Always, that's what we aim to do. Include patients, and I would say residents, and families at every level throughout the healthcare system. Through conversations, sharing ideas, and inviting the patients in, the outcome will be better healthcare for everyone. We're not launching a campaign that begins and ends, but together we're creating a cultural shift, a unified mindset where the patient or resident is truly one of us. It's a whole new healthcare approach. It takes a whole lot of change, and it takes courage. It takes all of us working together to make our system the best it can be. We will listen more, we will engage often, and we will include always. So as I worked with some of the patient and family advisory councils throughout the state, it was important. These were kind of the key learnings that I found, in that it's really relationship based, and the relationships are not only between residents and families and staff, but staff to staff, nurses to doctors, doctors to dietary, all those different connections, that the relationship is really what matters if we're going to make a difference. That residents and patients and consumers, I like to be all-inclusive of everyone, should be included on the team, not just at the point of care, but actually at an organizational level. And that this work doesn't really easily fit into a roadmap or checklist. When I mentioned the TAIR is Human report from 2000, I was surprised that they actually called out patient and family engagement at that time, and there were a lot of resources created, lots of checklists, lots of roadmaps on how to do this work, and yet 15 years later we find that a lot of the work has not been done because it's hard. It's a different way of doing business and taking care of people. Patient or resident and family engagement should really be embedded in everything that you do. All the initiatives, projects, process improvement efforts. One of the first things you could think of is, how do I include a resident or a family member in this new project? Like I said, you can think of it as a new way of doing business. We found certainly that leadership support is critical. It starts at the top, and if they understand what it is and what it can look like, there is a lot more success, and it's sustained a lot longer. One of the things that I recommend starting with is ask more questions. We ask the typical questions of, what are your symptoms, what do you need, those types of things, but think about other questions you can ask, like, what was that like for you last night? Or, how could I be a better caregiver for you in this situation? This kind of work can be creative and fun. It doesn't have to be really prescriptive. One of the facilities or organizations that I worked with was really hesitant to do the work, and I said, this doesn't have to be a big deal. Just do something fun. And so they decided to do a tea, and they invited people from all over the community, including their nursing home, to come to a tea and just talk to them. And I was at that tea. It was probably the biggest impact was that the CEO of the organization was there, and he said to all of those community members, for the last 25 years we have thought we knew what was best for you. And what we're finding is that we've never asked you, and we're not really sure what you need or want from us. And so we'd like to start this council to find out more about those things and involve you in the work as we move forward. And they invited, I think it was 12 community members. They all showed up, and they were hoping that half of them would join the council and commit to being part of it. At the end of that hour tea, all 12 of them joined and asked, can we invite some of our friends to join this council as well? So it was a really exciting way to kick off kind of a new way of doing things. And it was fun. It was fun for the staff to plan it, to invite them into their organization, and it was fun for the residents and the community members to think that they have value and that people wanted to hear what they had to say. Always remember that patient, resident, family engagement is a journey and that it is continually evolving. Many times I've heard people say that they hit a roadblock. Maybe they had a resident tell their story and it didn't go very well, and so they want to quit and shut it down, not do it anymore. And I would just encourage you to look at maybe what went wrong, what were some of the barriers, and how to reframe it or set it up for success in a different way. Many, many, many people that have tried patient and family engagement will tell you that they have to restart or they have to reframe how they're approaching it, partly just because of timing, partly because of other things on the plate, and partly because we're humans, and it is a human endeavor, and it's relationship-based. So one of the things I want to leave with you that I hope that will stick, and from your comments on the side that I've seen so far, I think you are all the people that get it online, that residents and families are really experts. You know, they may not be experts in their medication or payment, definitely. We all have struggles with payment and how that works. But they are experts on who they are, what side effects they might be willing to tolerate or not, what risks they may be able to tolerate or not. But it's important to consider them as experts and presume that they know what they are talking about. They're really innovators, and I like to say that people within the system kind of wear these system glasses where they see everything a certain way, and they get stuck because they have those glasses on. They come to work every day and it's the same. Residents and families can bring you a new perspective on how to look at things differently because they don't see it through those system glasses. They haven't been involved in the system and don't know how it works. And so they can bring some really innovative ideas to the table that may or may not work, but are certainly worth listening to. Clearly, they're all passionate about safety. They want to know that they're safe. Many of them assume that if they are in a healthcare place of health that they are safe, and they are surprised to find out that errors do occur. They're willing to work for free. Part of what they get is just a feeling of purpose when they're working with you. And 100% across the line, every patient, resident, community member that I have asked that I say, why do you want to do this work? What drives you to do this work? 100% of them say, I just want to make a difference. And so I think that's an important concept to keep in mind when you're thinking about inviting them and what they get out of it. So like I said, I did work with quite a few organizations across the state of Minnesota. What you're seeing here are the first Include Always Patient and Family Advisory Councils. All of these here were a combination of hospital, clinic, and long-term care coming together. Many of those were because of the medical home model, but also because they were small rural communities, so it was hard to find people that would engage at councils at these different organizations, so they brought them all together. And many of them were hesitant. Like I shared before, it was a scary thing for a lot of these organizations to do, to say, come and partner with us on this really important work. So I just want to give a couple examples of the success that they found. One of them, actually it was the same organization that had the tea, invited their residents to trial new beds. So they knew that they had a budget for new nursing home beds, and typically the nurse, director of nursing, would do all the research and trial the beds, but she decided, no, we're going to let our residents choose. She gave them all of the information, the written information that she could find, and then they got to spend nights sleeping in those beds, and they are the ones that decided which beds the nursing home would purchase. That same facility also, when one of the residents came to the advisory council, she had recently had a doctor's visit, and the clinic was attached to the nursing home. And so the way they did it is they would bring their residents over on gurneys in gowns to their doctor visit. And she was just mortified. She said, I know everybody in that waiting room, and I'm sitting there in a gown laying flat on my back. And honestly, the staff within the advisory council didn't realize that that was happening and went right to work on how to change that procedure. And they gave the residents options on whether they wanted to come on a gurney, in a wheelchair, what they wanted to wear over to their appointment, and they also provided an extra room where they could wait if they weren't comfortable waiting in the public waiting room with all the other community members. One of the other really great stories I like to share is it was actually a hospital that had an emergency room that needed to be remodeled, and they knew that they had the budget, they were ready to go, but they decided with their new advisory council that they would let the members of that council do what's called a walkabout. So they invited them to come for an hour to tour the emergency room. They gave them clipboards. They said they could use their phone. They told them about the HIPAA so that there was nothing negative being captured or, private. And they just went around and they recorded what they heard, what they saw, what their impressions were. And the following week they had a debriefing session. And it was unusual because there were a few things that were unanimously voted. They did not do this walkabout together. They were all separate. But when they came together, there were two items that were unanimously reported. One of them was, your nurse's station is a complete disaster. There are charts mixed in with People magazines, mixed in with Diet Cokes, mixed in with syringes. And I am a mother of 4, so I was highly empathetic for that nursing staff, because I know that my house can look like a disaster, but I know where everything is and my kids are safe. And I'm sure that that's the case at the hospital. The nurses knew what they were doing. They knew where things went, and the patients were safe. And yet, the perception of every single one of those people who did the walkabout was, if you cannot take care of your desk, how in the world are you ever going to keep me safe with the things that I have wrong with me? So the director of nursing, I thought, was pretty brilliant. She went to work right away. She didn't spend any money besides her time, but she reorganized the desk area. She wrote policies and procedures and did a different workflow. And I'm not sure who was more excited, the nurses who got a new workspace that was clean and organized and everything was put in its place, or those community members that gave their time freely, made recommendations, and saw that what they said made a difference and that it was going to be acted on. Now, the second unanimous thing that they said was a little different. They had a big screen TV in the emergency room that didn't work. And some of the people had young children, and they said, I would not come into this emergency room with my kids screaming for 2 hours to wait for a doctor without a TV to watch. And this is one of those areas where people get really fearful because they assume that if they're going to have residents and family members give input and recommendations, that they have to follow everything that they say. And that is not ever going to happen. It's just not feasible. So what happened is the director of nursing said, I would love to provide a new TV, but right now that just isn't part of the budget for this remodel. What was fun about it is that those community members said, okay, well, what can we do to fundraise and get the hospital a new big screen TV? And that's what they did. And so it was a win-win for both sides. On top of that, the director of nursing started getting phone calls from every department in the hospital saying, hey, you know that group of community members that's walking around in the emergency room? Can we have them walk around our department? Because what they started to see is that there was a power in the voice of the community member or the patient or the resident that was listened to. And probably they had the same goals. They wanted the same things. But when the community members came in and shared it, it went a lot farther, a lot faster. So those are just some really brief examples of what was successful from the actual patient, resident, family advisory council working in partnership with the organization. So I want to give you an opportunity to put some information into the chat box again and share, like, what are the barriers to really authentically engaging with your residents and families, specifically to improve your safety and quality within your organization? And I'll give you a minute to put those in while I go. I'm going to have you still do that, but I'm going to move to the next slide. And I just want you to kind of think about these what-if questions. Maybe some of you do these things. Maybe you've thought about those things. But what if a resident was added to your quality committee? Maybe start with one. I always suggest that you add two so that they feel like they have some peer support. Or maybe a resident and a family member so that you get both sides. What if a group of residents completed a walkabout like I talked about in one of your departments? And sometimes, too, the walkabout can be two-sided. It can be that the residents and families are trying to give you input, but it also can be flipped in that can you give them education about how your departments work, and then ask for feedback about how would that look different in your eyes, or what would you say would be more helpful to us to improve our service, whether it's dietary, maintenance, housekeeping, you can do any place. What if you asked residents and families more questions about their experiences, preferences, and opinions, and not just about what kind of breakfast they want or what time they need to want to wake up, but more in depth, like what can I do to make this better for you? How can I be a better caregiver for you? And whether or not you can do it, at least you're giving them an opportunity to share some of those things and you can ponder on them. What if you created a joint committee of residents, families, and staff to work on a specific safety topic that you're struggling with? And what if the organization was transparent about a problem? I always think I think that falls are always a big problem in healthcare, or infections. If that's something that you can't get quite a handle on in your facility, consider asking input from the residents on why why that might be happening in their opinion and what they think could solve that. So I'm seeing that one of the barriers is that varying cognitive levels of residents, and absolutely, and I would say that is across the board. You know, when you're in healthcare, especially nowadays, you're pretty severe. If you're needing care and you're inpatient, you have a lot of issues. So you might have to take some time and decide which ones are most available to help you, or that, or maybe, you know, start with those family members to begin with. Voluntary participation in the committee. I'm not exactly sure what that is for the barrier. If you can put in a little bit more. Time is a barrier. When you ask what else can I do, you have to have time to put those things in action. And that is absolutely true. I can share with you what I have found in my work so far is that there is kind of that front end time commitment, but what facilities and organizations are finding out is that it actually makes their work so much easier, and the time is a lot less. And in fact, the one facility that had the T actually quickly turned over their committee to be co-chaired by one of the residents who had a lot of experience with business, and so he wanted to have a different agenda or keep some three-ring binders, so it actually really helped the hospital to get organized with it. Fear of giving an inch and they take a mile and want the moon. That is, again, you have all the barriers. I have heard every barrier that you are writing, and it's all absolutely true. And I think some of it is just being really transparent and honest about it when you start this and saying, we really want to partner with you. We're afraid we can't meet all of your, I don't want to say demands. There's got to be a better word, but that's what's coming to my head right now. But we want to do better at meeting some of those expectations that you might have. And we also think you have a lot of input that we haven't thought about, and we want to know about those things. A collaboration that needs balance. So the healthcare system restraints and wanting a perfect atmosphere. So I think part of that is, you know, there is a lot of regulations and all those things that you have to stick to, and it's hard to balance what kind of that perfect world with what's in reality and what you have to do. So I think, again, you can be really honest. Recently, I was at a conference about diagnostic error and when things go wrong, and I heard a lot of the physicians say, oh, well, we don't tell them if we are testing for cancer because that would make them nervous. And over again, I had to say to them, do you really not think that they're already considering cancer? And that if you are honest with them, they might be relieved to know that you're already on top of that and that you've already thought about that. So I think that, you know, residents probably understand that the system is pretty messy. They have to deal with a lot of the mess on their end. And so really just calling it out and saying, this is a really hard system to work in, and how can we do it better together? Another barrier is used to a system of not including the residents because we feel that we know what's best, and that's true. So I think that mind shift and having a different perspective, a new perspective, is important. That's kind of the baseline for doing this work differently. Understanding true financial constraints. They pay a small fortune to stay in a facility, but they don't understand how quickly that money is taken up in operating expenses. So on a lot of these questions, what I would say is, you know, if you have kind of that forum of talking to residents and families and partnering with them, there are ways that you can explain that then when they understand, they're more empathetic and willing to partner with you in different ways. again, this is a little unrelated. The diagnostic error conference that I went to, I was actually pretty shell-shocked to understand what goes into a diagnosis. Like the amount of brain power to decide that someone has the flu or not is pretty big when you start hearing what goes through a physician or nurse's mind when they're trying to determine what the diagnosis is. So listening to that and being exposed to it as a patient, I had a lot more understanding of why in the world they don't have time to talk to me for 15 minutes about what's going on in my family. I would like them to, and I think that's important. Don't get me wrong there. Don't misquote me on that. But I think that it's important to really share with residents where the money's going, why it takes up so much of your operating costs, and they just need to know sometimes. So I am going to show just a really quick clip. People love this clip to kind of help transform their thinking into a model of including people differently, but also thinking about your colleagues and partners within your organization a little bit differently. And at the end of that, I think we have a couple minutes to take some questions. So I just want to make three really quick comments, and then I can take a couple questions. In that, I was just thinking about that video and how many times I've showed it, and actually half of the time the people that want the link to that YouTube video are the residents and patients. So that might be an idea as you start some of this work, is to share that in your councils if you start to do more work that way. I did fail to mention that the Include Always does have a website that you can go on that shares a lot of stories across the state of Minnesota on successful ways that people have done patient and resident and family engagements. And if you have a story that you'd like to share on that website, we would be open to highlighting that for you. Or if you'd like to participate in a complimentary phone consult on how to increase your resident and family engagement in your facility, I did provide my contact information. So if you have any questions, we have just about 2 minutes.
Thank you, Lisa. Adrienne, can you please remind our participants how to get in queue for questions or comments?
Thank you. To ask a question, please press star, then 1 on your touch-tone phone. If you wish to be removed from the queue, please press the pound sign or the hash key. There will be a delay before the first question is announced. If you're using speakerphone, you may need to pick up the handset first before pressing the numbers. Once again, if you have an audio question, please press star, then 1 on your touch-tone phone.
Also, you can put any question you might have in chat. And while we're waiting for those, I just want to thank Lisa again for speaking with us, and to let you know that as you exit from this webinar in a couple minutes, a window will open for a short evaluation, and we're also including a link to the evaluation in the chat box in just a minute here. So we'd appreciate it if you take a minute to provide feedback on today's session, and once you've completed the evaluation, you will all receive a certificate of participation. Another reminder that the session was recorded, and it will be available on the Lake Superior QIN YouTube channel in 2 weeks or less. So if there are other people in your organization that you think might find value in this webinar, please, we encourage you to share that. Adrienne, is there anyone in queue?
We have no audio questions at this time.
Okay, great. Okay, did you have anything else, Lisa, that you wanted to share?
I don't. Just thank you so much, everyone, for joining and listening to my stories and experiences. And thank you even more so for your chatting in the box. I think that's really helpful to understand and learn from each other.
Thank you very much, and thank you, everyone, for participating, and you have a great afternoon.
Thank you, ladies and gentlemen. This concludes today's conference. Thank you for participating, and you may now disconnect.